Hi, Nirupama Chatterjee here with my channel Health Alerts. And as usual, when I say a well-informed person is more likely to survive longer and have better quality of life than uninformed ones. So it is now well known that an apple a day may no more keep a doctor away. So we must keep ourselves aware always on the latest happening in the field of health and how we are updated on the latest health information. So to continue, today's topic will be low back pain, which is a very common indication and it actually affects both male and female population. And at most of the people in their lifetime come across this low back pain many times. So what is low back pain actually? The low back, also called the lumbar region, is the area of the back that starts below the rib cage. Almost everyone has low back pain at some point of life, as I said. Fortunately, it often gets better on its own. When it doesn't, your doctor may be able to help with several effective treatments. Now, symptoms of low back pain. These might range from a dull ache to a stabbing or shooting sensation. The pain may make it hard to move or stand up straight. Pain that comes on suddenly is acute. It might happen during sports or heavy lifting. Pain that lasts more than 3 months is considered to be chronic low back pain. If your pain is not better within 72 hours, you should consult a doctor. Symptoms that require urgent care when it is low back pain. See a healthcare professional anytime you have back pain after a fall or injury. The same goes if you have back pain with bowel or bladder control problems, leg weakness, fever, or pain when coughing or peeing. Muscle strain or sciatica, what it is? Muscle strain is often the cause of back pain from heavy lifting or vigorous exercises. But sometimes it's due to small jelly-filled discs meant to protect the space between the vertebrae. When one of these discs bulges or breaks, it can push on a nerve. When it's the sciatica nerve or when it is the sciatic nerve, pain runs from the buttock down one leg. This is sciatica. Back pain culprit. It can be your job even. If your job involves lifting, pulling, or anything that twists the spine, it may contribute to back pain. However, sitting at a desk all day comes with risk of its own, especially if your chair is uncomfortable or you tend to slouch. Back pain culprit. It can be your bag even. Although you may wear your purse, paper bag, backpack or briefcase over your shoulder, it is the lower back that supports the upper body, including any additional weight that you carry. So an overstuffed bag can strain the lower back, especially if you carry it day after day. If you must tote a heavy load, consider switching to a wheeled briefcase. Back pain culprit, again your workout. Overdoing it at the gym or golf course is one of the most common causes or of overextended muscle leading to low back pain. You are especially vulnerable if you tend to be inactive during the work week and then spend hours at the gym or softball field on the weekend. Your posture. Moms were right when they said stand up straight. Your back supports weight best when you don't slouch. This means sitting with good lumbar support for your lower back, shoulder back, with feet resting on a low tool. When standing, keep weight evenly balanced on both the feet. Now, herniated disc can be one factor for your low back pain. The spine's vertebrae are cushioned by gel-like discs that are prone to wear and tear from aging or injuries. A weakened disc may rupture or bulge, putting pressure on the spinal nerve roots. This is known as herniated disc and can cause intense pain. Now, what are the chronic conditions or what can be the chronic conditions? Several chronic conditions can lead to low back pain. Spinal stenosis is a narrowing of the space around the spinal cord which can put pressure on the spinal nerves. Ankylosing spondylosis inflames the joints of the spine and sometimes the shoulder, hips, ribs, and other areas too. It causes chronic back pain and stiffness. In serious cases, spinal vertebrae start to fuse, grow together. Fibromyalgia causes widespread muscle aches, including back pain. Now, chronic conditions, a fat wallet can trigger piriformis. You might not think of too much cash as a source of pain, but, but, but a fat wallet can trigger piriformis syndrome. The condition can affect men who wear their wallet in the back pocket for their pants. This puts chronic pressure on the piriformis muscle and can aggravate the sciatic nerve over time. You can avoid this problem by keeping your wallet in a front pocket or a jacket pocket. Now, who is at risk for low back pain? Most people experience back pain first when they are in their 30s. The odds of additional attacks increase with age. Other reasons your low back pain may hurt include being overweight, being sedentary, lifting heavy stuff on the job. Diagnosis of low back pain. To help your doctor diagnose the source of low back pain, be specific in describing the type of pain to your doctor, when it started, related symptoms, and any history of chronic conditions. Your doctor will probably not or may need to order X-ray, CT, or MRI before starting the treatment. Now, there are certain home cares for low back pain. Back pain due to muscle strain will usually get better on its own, but you can take steps to make yourself more comfortable. A heating pad or a warm bath may provide temporary pain relief. The bed rest debate. When your back hurts, you may not feel like getting out of bed. But if the problem is muscle strain, doctors recommend returning to your normal activities as soon as possible. Studies suggest that any more than a day or two of bed rest can actually make the pain worse and may reduce muscle tone and flexibility. Now, yoga. If back pain doesn't go away in 3 months, there is evidence that yoga can help. In one study, people who took 12 weeks of yoga classes had less back pain than those who got a book about back pain. The benefits lasted several months. Just make sure you get expert instruction so you don't hurt yourself. Spinal manipulation. Now, chiropractors and some osteopathic doctors may try to move the joints of your spine to treat low back pain. They apply pressure with their hands to bones and surrounding tissues. This treatment is not appropriate for everyone though, so be sure to tell your provider about all your symptoms and health issues. Massage therapy. Massage may relieve chronic low back pain, especially when combined with exercise and stretching. A researcher noted patients who did all three were able to move around easier and less short-term and long-term pain. Acupuncture, a well-known therapy. Can acupuncture treat back pain? The evidence is mixed for people with short-term back pain. Research showed that these people benefited from sham acupuncture as much as from a real acupuncture. However, in other studies, people with chronic or long-lasting back pain did show improvement after receiving acupuncture treatments. Medications. Mild back pain often feels better with over-the-counter pain relievers such as acetaminophen, the other name of paracetamol, ibuprofen, or naproxen. Pain relieving creams may be helpful for muscle aches. For severe pain or chronic pain, your doctor may recommend prescription medications. Injections. If simpler therapies and medications are not helping, your doctor may recommend injections to the back. One procedure called a nerve root block targets irritated nerves. Injections for back pain usually contain steroid medication. Then the other option is surgery. If long-lasting back pain is interfering with your daily life and other treatments have not provided relief, you may be a candidate for surgery. Depending on the cause of your pain, a surgeon may remove a herniated disc, widen the space around the spinal cord, and or fuse two spinal vertebrae together. Physical therapy. If back pain has left you inactive for a long time, a rehabilitation program can help you strengthen your muscles and get back to your daily activities. A physical therapist can guide you through stretches, strength exercises, and low impact cardio that will help you be fitter without straining your back. Strengthening the back. Strengthen training can help your lower back. In flexion exercises, you bend forward to stretch and strengthen the muscle of the back and hips. In extension exercises, you bend backward to develop the muscle that support the spine. If you have back pain, talk to your doctor or physical therapist about exercises that are safe for you. Preventing low back pain. There is no sure way to prevent back pain as you age, but there are steps you can take to lower your risk. Stay at a healthy weight, exercise regularly, lift your legs, not your back. This is very important. Lift your legs, not your back. Make sure your workstation position is not contributing to your pain. Now, to conclude, I always sign off with a laughter dose because laughter is the best medicine as is known universally. So today's laughter dose, think deep. This is the insertion. Your first birthday is technically your second birthday. Think it over. Meanwhile, thanks for watching. Do subscribe to the channel, like and share. And from me, for now, it is signing off. Thank you for watching once again. See you soon in my next episode. Thank you. Bye bye.